motion. So you've just read the motion. Could you then now tell us what is it that you want the House to do? As usual, then you'll ask the member you've appointed to second for you.
Thank you, Mr. Speaker. Mr. Speaker, I would say this motion, I've personally moved it out of experience of what I've gone through the public health facilities, having been a former chair of health committee, and I can see Honorable Nyikal is also in the House, and what we experience, Mr. Speaker, even at the constituency level and our villages level. Mr. Speaker, currently our hospitals or our healthcare starts from level 1, which is at the community service, all the way to level 6. And currently in the nation of Kenya, we only have 6 public health level 6 health facilities, which includes the Kenyatta National Hospital, the Kenyatta University Teaching and Referral Hospital, we have the spinal injury, we have Moi Teaching and Referral Hospital, we have Odhaya, and we have Mathari Mental Hospital, Mr. Speaker. Mr. Speaker, the definition of universal health coverage is a key global health goal that ensures that all people have access to essential health services without facing financial hardship. It is crucial for achieving health equity. The Constitution in Article 43(1)(a) of the Kenyan Constitution guarantees that every citizen, and I want to mean that, has the right of the highest attainable standard of health. This legal foundation is essential for driving UHC forward in Kenya. And the Kenya UHC Policy 2020-2030 gives that the Kenya Universal Health Coverage Policy is aimed at expanding access to affordable health services for all citizens with a particular focus on social health fund, which is SHIFT, to improve health financing and service delivery. What are the current challenges are we facing in health facilities in Kenya, in healthcare system? The biggest and the main one is funding constraint, where for us to achieve UHC in Kenya, we lack sufficient funding for the public health care. Public hospitals are often underfunded, limiting the ability to provide quality services. And Mr. Speaker, I know even in this House, through SHA, we are being deducted a lot of money to go to this funding of health. But Mr. Speaker, I'm more than convinced. If we are able to equip our hospitals, our public hospitals very well, if we are able to have enough doctors there and nurses and the staff to take care of the patients there, if we are able to have enough medication, we might not need a lot of deduction of our financing that we are getting even from our pay slips, and not only us, but by all public officers and anybody who have a pay slip. But Mr. Speaker, even when this money is deducted, where is the huge chunk of the money going for? Is it to the public facilities where normal wananchi, where the people you represent here go to? Or do we find that this money ends up in the high-end hospitals where only a few Kenyans can be able to access and afford, Mr. Speaker? The quality of care, Mr. Speaker, in public health services, especially in rural areas, suffers from inadequate staffing, outdated equipment, and lack of essential medicines, resulting in significant disparities in service delivery. And I want to challenge members of this House, if you fall sick in your constituency, which is this hospital that you can be able to go and be attended to with the care, or will you wait to be airlifted to Nairobi or out of this country? Mr. Speaker, we have a chance as this House to make sure that even yourself, your siblings, even the people who are very close to you who elect you, can be able to access to quality health care with proper medication, with quality care, even at the village level, because we can have enough funding in our society. I know we have privatized a lot of healthcare, and I am not against anybody who has a health facility as a private person. They are assisting this government. But do we really want to commercialize health in exchange of how few people in this country? Many public officers, Mr. Speaker, civil servants and state officers use private healthcare due to comprehensive insurance coverage from their employers. This has diverted resources away from public hospitals, limiting their revenue and ability to improve. And if I will do a check now, Mr. Speaker, in this House, we know we have a medical cover, which is almost at around 10 million per person. And this covers around 6 of our members in our families. Mr. Speaker, how many of us have visited Kenyatta National Hospital recently? Or do we all go to private hospitals But, Mr. Speaker, the other thing is, these people who will treat us in private hospitals are the same doctors that we have employed in the public facilities. So we end up that they spend a very few minutes in the public hospitals and they rush to the private hospitals where they can make extra coin. Mr. Speaker, the impact of this mandatory use of public health facilities will increase funding for public hospitals, will have better access to healthcare, and will improve the public health system. Mr. Speaker, I had an experience in the private sector in Kenyatta National Hospital, where, Mr. Speaker, I went to admit my dad. And I was shocked, Mr. Speaker, that at this age and era, when you go and do admission, it is the private sector of Kenyatta National Hospital, which is a level 6, that you are given a basin to carry you, the patients, the things that they are given, the tissue paper, those things that they are given for admission. And then you pass through the accident and the accident place, you go through the lifts. And, Mr. Speaker, entering even those rooms, Mr. Speaker, I was shocked that you're finding some old bathtubs, you're finding very old, Mr. Speaker, and you're in the private sector, the private section. I asked myself, then what happens to the people who are in the normal wards, Mr. Speaker? If we put our resources in Kenyatta National Hospital, which is our national hospital, where people used to come out from other nations to come and be treated. I think Honorable Nikal has the institutional memory that even before, even presidents would go for medical care and medical attention at Kenyatta National Hospital. Why did we go backwards? Where did the rain start beating us? That our public hospitals are in such pathetic condition. Mr. Speaker, we only have one national medical hospital, which is Mathari. When I was the chair, we had a privilege to go and visit Mathari. It is in very pathetic condition, Mr. Speaker. That is why we are seeing we have lost a doctor who went to a private facility. There's a story of that lady being struggled, a person who had a future, Mr. Speaker. But because we have very limited spaces, mental health is a challenge currently in this Republic of Kenya. But how many public health, mental health facilities, even at our level 5, at our county level, Mr. Speaker, can anybody, our young people, go and attend and get proper mental health checkup? Mr. Speaker, if you look at Mathari, and that is our only national institution, then I am lost, Mr. Speaker. We have a huge percentage of population of Kenyans who cannot be able to afford going to the private facilities, Mr. Speaker. And I'm not saying that once you have this, you cannot go to the private. If you have your own money, if you have your private insurance, you have access and you can attend and you can go to the private. And if there's something that cannot be treated in the public hospitals, then, Mr. Speaker, that's why I've said the ministry will come up with a policy. I am not limiting anyone. But let us first support our public institution, Mr. Speaker, so that we can be able to improve. Mr. Speaker, I want to challenge members of this House because if you look at the education, we find that when we used to have the 844 system, children could go to private primary schools and they will all struggle to go to public secondary school because the public secondary schools were well managed, they had good teachers, and the students were passing very well. But, Mr. Speaker, we shy away from attending to our public hospitals because we are afraid we might get congestion. And why do we have congestion in these hospitals? We don't have enough doctors. We don't have enough nurses. We have had even patients being killed. There's not even good services or even security. Mr. Speaker, if you're able to finance our public institutions and especially the health services, the health hospitals, Mr. Speaker, then we can be able to empower them and make sure that we have good quality education, with good quality healthcare in Kenya. Mr. Speaker, we need proper infrastructure investment and constant parks enriched, which will improve public health services. And with strategic investment in the infrastructure of our public hospitals, we can elevate their standards to match those of private institutions, ensuring that there is continuous availability of health products and technologies that includes drugs, the latest diagnostic equipment and consumables. A well-equipped public hospital with modern technology, sufficient medical supplies, and improved working conditions will enable healthcare practitioners to provide quality services that meet international standards. Furthermore, increasing the remuneration and incentives of medical professionals working in public hospitals to match those of their private sector counterparts will encourage them to dedicate their time and expertise to serving the public sector effectively. Countries such as Thailand and United Kingdom have invested heavily, Mr. Speaker, in their public health system, ensuring that both ordinary citizens and public officers receive world-class health care without seeking private alternative. In fact, Mr. Speaker, private hospital care in UK is 3 times more expensive than public sector care. So, Mr. Speaker, I would want to urge this House to support this motion. What I am just saying is that we need to have a policy by the Ministry of Health so that, Mr. Speaker, we can make sure that we have enough funding. If this House, Mr. Speaker, have 10 million cover, times 349, that is already 349 million only from this House that can be able to support our public health care, Mr. Speaker. I want these members to have confidence in their facilities, though health is devolved from level 5 and going down, Mr. Speaker, that when you are in your constituency, your child falls sick or you have gone to stay in the village, or yourself, you can confidently walk in and find a doctor. Mr. Speaker, if these doctors know that anytime a member of parliament would walk in and they, come for a medical attention, we will have them there on time, we'll have quality services. And finally, Mr. Speaker, for this House to believe that the public health facilities can work, I urge all of you to visit it's not very new, but it's a modern Kenyatta University Teaching and Referral Hospital. Just take a tour. Tell me which hospital in this Kenya, or even in East Africa, or even in Africa, can match the standards that we have. The modern theaters that we have in KU, we have the PET scan for cancer, we have everything that we need. And KU soon will have a 300-bed facility for children only, a children's hospital, Mr. Speaker. Why then can't we support our own? Instead of spending a lot of money going to pay a private facility, why don't you spend that money, which might be even half or quarter, to the private institution? Make sure our children are employed. Make sure that our young people who cannot afford, Mr. Speaker, and we have the Gen Zs and their majority, who cannot afford to pay for themselves to go to hospital, then they will have access because the money will have gone back to this public hospital. Mr. Speaker, I beg to rest my case there, and I kindly ask this House to join me and support this motion. And I ask Honorable Ziggy, Women Rep Taita, to support and second. Thank you, Mr. Speaker.
The member for Taita, Taveta.
Thank you very much, Speaker, for this opportunity. And I want to begin by also thank you, Honorable Sabina Chege, for bringing such a very important motion in such a time where it is really needed on matters health and most importantly, universal health coverage. Mr. Speaker, as we are aware, it is a right of every citizen to access good health care, quality health care for that matter. And Mr. Speaker, talking of our public health care, if only we can all support by supporting, empowering the public hospital with good infrastructure. Mr. Speaker, we are all able to utilize the public health services. Because, Mr. Speaker, in most cases, majority of doctors, medics, who even work in those private hospitals are the same people who also, they are civil servants who work in public hospitals and at the same time work in the private hospitals. So, Mr. Speaker, if we can give, we can be keen on our public hospital and give them the resources that they are needed, then, Mr. Speaker, it is possible that all of us can make use of the public hospitals. Mr. Speaker, I have cases in Taita Taveta of late on matters healthcare and public hospitals, whereby we have a number of maternal deaths in Taita Taveta, Mr. Speaker, which is not interesting at all. We have lost women giving birth, Mr. Speaker, in the recent days. Mr. Speaker, as I pass my condolences to the family, including a family of MCA, I want to say that, Mr. Speaker, and I have a statement on the same, But then I want to take this opportunity to support and second this motion by Honorable Sabina Chege by saying, Mr. Speaker, we need
Order,
to...
members, order. Shall we listen to the honorable member for Taita Taveta in silence? Go ahead.
Thank you, Mr. Speaker, for protecting me. It was a bit noisy and now I can concentrate and focus. But I was winding up my statement by saying that, Mr. Speaker, I second this motion that we need to have a policy on matters universal health care and support to the public health institutions, especially public hospitals, so that, Mr. Speaker, these hospitals are able to give the services that is required to all the citizens. Thank you, Honorable Sabina, for bringing such a motion. Thank you.
Have to end by...
Mr. Speaker, I second.
Thank you. Oh, members, this is a very important motion. I would request the members debate with decorum. You can actually consult in low tones and enable members' voices to be projected and heard as a debate. I therefore propose the motion or the question that aware that Article 43(1)(a) of the Constitution provides every person has a right to the highest attainable standard of health, which includes the right to health care services. Further, aware that the government committed to accelerating attainment of universal health coverage to ensure all Kenyans have access and receive essential quality health services. Cognizant of the fact that in 2020, the Ministry of Health adopted the Kenya Universal Health Coverage Policy 2030 with the theme Accelerating Attainment of Universal Health Coverage, which is currently being implemented through the introduction of Social Health Insurance Fund, noting that there is need to increase the quality of care services provided in the public health sector, and concerned that the public health care services lack adequate funds to guarantee quality health care services, and further noting that the medical cover by the respective government agencies, further noting that civil servants, public officers, and state officers are accorded a comprehensive medical cover by the respective government agencies, appreciating that the use of the comprehensive medical cover by the public officers and state officers in public hospitals would guarantee sufficient funding in public hospitals. This House therefore resolved that the government, through the Ministry of Health, implements the Kenya Universal Health Coverage Policy 2020-2030 and introduces a policy on mandatory use of public health care facilities by all civil servants, public officers, and state officers in the country. So the first part then will go to the Honorable Hilary Koskei.
Thank you very much, Mr. Speaker. Let me begin by congratulating the Honorable Sabina Chege for this thoughtful and forward-looking motion, Mr. Speaker, and I think it's because of her experience as a good chair of the former Committee on Health in the 12th Parliament. Mr. Speaker, the Honorable Nyikal sat with me in some committee. And at one point, Mr. Speaker, he told us that during the 80s, he used to admit ministers at Kenyatta National Hospital. There was a time in this country, Mr. Speaker, when public facilities were better than private facilities. But in the early 90s, Mr. Speaker, there started a colossal contest of a war by the private sector to fight the public sector. And they started with our hospitals, our schools, and our universities. It used to be a mark of pride, Mr. Speaker, in those years when it was said that you finished school in St. Mary's Yala, Kericho High School, Mangu, all these private schools, all these public schools. But a time came when the private sector watered down the public sector. And today, if your child is not in a private school, you are considered a poor person. That is the tragedy of our country as it is now. It used to be a mark of pride, Mr. Speaker, to be treated in Kenyatta Hospital and the other public facilities in the Republic of Kenya in those years. But right now, if you are not admitted at Nairobi Hospital, Aga Khan, all these other private hospitals, you are a poor man, Mr. Speaker. It used to be a mark of pride to go to Nairobi University and study your degree. Moi University and the other public universities. Right now, if a parent does not take their children to Daystar, to Old Strathmore, and all this, you are considered a poor man. Because the private sector finally won a war against the public sector. And what this motion seeks, Mr. Speaker, is to revert the country, to reboot our system. I remember in the 90s, Mr. Speaker, in Nairobi, we used to drink tap water. Until one morning, KTN aired an article where some water in the tank mixed with a lot of chlorine was displayed as contaminated water. And the following week, there was serious advertisement of mineral water in the name of Keringet. That's how we lost our country, Mr. Speaker. And therefore, Mr. Speaker, what this motion is calling us to do is to lead as members of this House to seek medical attention in our public facilities so that the confidence of the people we lead can be built, Mr. Speaker. And I want to urge the people of Kenya that the war that the president is engaged in, through universal health care, through the funding model, all these are geared towards returning the country to the confidence of the public sector. And Mr. Speaker, the president is already doing a lot. There is already conversation that going into the future, even our own health centers and public dispensaries at home will order their medical supplies directly from KEMSA. Instead of waiting in a county government office for weeks without getting those deliveries. There is this Postal Corporation of Kenya which used to take letters across the country. We are telling them there are no more letters to take. People are digital. Start partnering with KEMSA so that you can make medical deliveries to our dispensaries, to our hospitals, and then enhance the levels of medical quality in this country, Mr. Speaker. When these things, Mr. Speaker, when the president started biting the bullet and introducing SHA, there was a lot of insults that Shisha, what they were saying, the doubting Thomases, who never wanted this government to succeed. Today, they are as silent as water in a pot. They are only selling now a narrow, a tribal agenda because this government is delivering on its mandate. And Mr. Speaker, we have to reboot the country and to start afresh. We have a Vision 2030, which is merely five years to come. We have not completed on universal health care, affordable housing, social security, and all this, Mr. Speaker. And I want to say, I'm supporting the motion so that going into the future, even, you see, in these private hospitals, Mr. Speaker, the best doctors treating in private hospitals are public doctors earning public salary. That must change, Mr. Speaker. So, Mr. Speaker, because of the interest of this motion, I don't want to spend a lot of time. I want to allow members to contribute and to support this motion by our Honorable Sabina Chege. Congratulations, Mheshimiwa Sabina Chege. Thank you.
Thank you. I was hoping that at some point in time, the Honorable Sabina Chege and the Honorable Hillary will tell us that they are giving up their medical scheme in Parliament. The member for the Agoreti North.
Giving up Thank you, Mr. Speaker. Mr. Speaker, I rise to support, and to support in this manner that indeed the issue of public health is an issue that, as Hillary has said, for the many years, we've had a challenge. But one of the things that we must allow ourselves to agree, and I pray, Mr. Speaker, that SHA is going to heal some of these things, and it is trying, because SHA is a service that has bypassed the treasuries of counties, and so I'm hoping the monies that go into the public hospitals can do something. Mr. Speaker, we are faced with two challenges, even as we support this. Now, the first challenge is one thing we need to ask ourselves. What is it so difficult, Mr. Speaker, for any of our public hospitals to just be clean? that you can walk in and walk in like any other hospital. Even in Europe, public hospitals are clean. And clean does not need anything. You have people who are washing. What is this that is so difficult? To make it a place where even when you walk in as a public person, you will feel you are walking into a hospital to be treated. Before even I'm treated by the doctor, I walk into a clean place. That is the challenge number one we must deal with. And one time I asked Kenyatta, what is this that is so difficult to just clean Kenyatta and make it a hospital that used to be those days? And Mr. Speaker, the other thing that we need to ask ourselves, while we know that promoting equity in public hospitals, which is a public hospital that serves the diverse of many of us, of our populations, Mr. Speaker, do we need to treat our people in the terms that we do? Especially, Mr. Speaker, when you walk in, you know, there's that hospitality-friendly receiving of a patient. Is there a need for us to also change that attitude and bring in, even as we bring in this? Mr. Speaker, the other thing, resource allocation. This motion will help us, yes, to assist in terms of resource allocation. Because the more we go in the public hospitals, by the way, I am treated at Kenyatta Hospital many of the times. And because I like going there, and the other one that nowadays has come, it's very affordable, Jalaram. We just walk in. The other day I went for my eye clinic just at Royal. These are hospitals that are very friendly to the public. They go for many medical camps. And you just walk in. My small dispensary, Gatina, you walk in, it is as clean as anything. And therefore, I always say, the challenge is not the hospital. The challenge is the person who has decided as a Kenyan, I want to run this hospital. If you want to run it well, it will do. It's the same way we run our CDF offices. You find some MPs are doing very well, excel, but we are in the same. And so, Mr. Speaker, it is not about the hospital or what is wrong. It is about us, me, the Kenyan who has been given the opportunity to serve in that office. I decide I want mediocre, it will be mediocre. I decide I want to make things work, it will work. And so for me, I will plead to us who are the ones who have given the opportunity to run even these hospitals, can we just make it right for our people? The other thing, Mr. Speaker, this motion now brings in is setting an example to us that it is important we demonstrate commitment that indeed to public service and institutions, Mr. Speaker, that yes, if I walk into that hospital, I have a commitment. I'm not just doing it for PR. I do it because the same doctors, and this is not something about just hospitals, even our doctors. Honestly, as you take me to your private clinic, what are you saying at that time, Mr. Speaker? Because I'll walk into the public hospital, I'll be treated the first day, the second day I'll be told where now to find the doctor, in his clinic. Can we have a culture of appreciating that when I walk there, you can treat me there, without now telling me now to walk into your private entity? Because that's how the private thing thrives. And number three, can we stop now making health in our country? And this House, Mr. Speaker, must come up with a bill that says, this is the moderate rate you can charge. Because what we have now gone to is, in some places, people believe health is a maximum profitable entity. It's no longer a place where you can say affordable. That's why even when you have SHA, you'll still pay some sum of money, and you'll be wondering. And maybe that's why our young people even are wondering, what is all this we have made to be so difficult that they can't work even in a hospital, afford the hospital, Mr. Speaker? That is why we are in this crisis. And we must ask ourselves, how do we become accountable? How do we become an example of those who would wish us to serve? And that is the other thing, Mr. Speaker. Mr. Speaker, reducing inequality, this motion brings in the issue of supporting institutions and also just looking at the social economics that we have, all of us. And so even as we do all this, and even as we say we are bringing in the policy, until we change the attitude of ourselves, until we realize all these things we are not doing for just today, it is for generations. Those who built for us Kenyatta Hospital are wondering, why is it that we don't have another bigger Kenyatta Hospital? They are wondering. I mean, you look at what their forefathers have done for us. We as this generation, Mr. Speaker, we have very less. In fact, we are killing every institution they tried to build. We have created so many things until we have made them so political, until people wonder now. And it is our mistake, and we must deal with that mistake. And so even as we talk about health, and even as we talk 2020 to 2030, you realize when we were doing the 2030 vision, and we need to thank the president. I know many will say everything, Mr. Speaker, but he has tried to look at what was the vision of 2030 and how can we achieve a few of the goals that the late President Kibaki wished this country would have been. That is why we have that affordable healthcare, SHA. It is in the Vision 2030. That is why we have affordable housing. People complain. Affordable housing is a vision of 2030 where we agreed as a country we shall have 200,000 units a year, which we have never achieved. We are about to finish the Vision 2030. I think there are many other things we have not achieved, but can we achieve a few for the sake of those who started the vision? Even when they are gone, they will feel that we left something for this country that we are able to remember. And as I finalize, Mr. Speaker, it is for me to plead to our young leaders that indeed all these things have foundations and have steps. We have wronged, yes, but you cannot tell me you cannot also join in to make it right. That you're speaking on the periphery and pointing fingers. There is no longer pointing fingers. We are awaiting Vision 2070, and I'm hoping the president, as he moves to 2027, will have started a foundation of what is this we can achieve beyond 2030. What is it that we have not achieved? What is it that we have not even started? Because we have many issues, Mr. Speaker, and you remember the SDGs. When we started the Millennium Development Goals, when we came and realized we are finalizing, we came into the SDGs. And so the 2030 vision must be picked and we check. The Agenda 4 that time the president, former president, and the president now head is the same agenda the president is pushing. So we can't be there then. At the same time, we are the ones pointing fingers. We are the ones fighting ourselves. We are the ones killing the agenda. We are the ones saying they are doing nothing. It is Vision 2030, and this policy of health is part of that vision. I beg to support, Mr. Speaker.
Oh, members, before we go to the Honorable Member for Seme, join me in welcoming students from Blessed Christian Center School, Makadara constituency, Nairobi County. They are seated in the public gallery. And students from the Fountain School, Gatundu South, Kiambu County. Students also from Mitero Primary School, Laikipia East, Laikipia County. The two schools, Fountain and Mitero, are seated in the Speaker's Gallery. They are welcome to follow proceedings this morning under the Houses of Parliament. Member for Seme.
Thank you, Mr. Speaker. Mr. Speaker, the object of this motion is to improve health services. And what we are proposing is that if we force people who hold important offices in this country, people who make decisions on all issues, money, to use the public services, then the public services will be better. That is actually the theory we have about this. But I think the bigger thing is to look at the ethos of the country. Services, education, and health actually reflect what the integrity of the situation of the country and the ethos of the people are. That's where it starts. If we really meant it, we don't need this We just have to all say, we all members of parliament, from now on, we are going to use public services as bad as they are. So do we need a law? Or do we need a motion? We start by actually looking at ourselves. It is true that in the 70s, it's not really the 80s, it is the 70s and a little bit into the 80s, public services were the best. Somebody said that it's true. I admitted ministers in Kenyatta National Hospital. Public universities have been the best. Now that is changing in our own eyes as we are seeing. Public schools have been the best when you are going to secondary, to high school. Only people who didn't do well went to private schools. Because public schools were the standard bearers. Public schools were the standard bearers. Universities are trying, but it is going while we are watching. So the history is that we can do it. But what has changed? What has changed is actually governance and the way we think about our country. Health services, why somebody said, why is it not possible that government public hospitals work? Health services are complex. You think of finance, human resource, infrastructure, the buildings, equipment, commodities that go in, but above all, the management. You can have all that. But if the ethos of our management is self first, it will not happen. I know the time when all the IV fluids in this country were actually being produced in Kenyatta, a public facility. I can remember the time when it was said that that is not the function of the hospital, give it to the private sector. We are struggling with the same thing with oxygen now. Again, we think it is the private sector. So I think as a country, what we first of all deal with is to be sincere as leaders that what we are saying is what we would like to do. Right now, we are focusing so much on financing health care. And therefore, we have brought the issue of SHA to replace NHF. I can tell you, over the weekend I was in my constituency and I was talking to border people, and they all told me that NHIF was better than SHA. That's what they were saying. But what is the issue there? It's because SHA, by design, should actually be better. It has 3 funds. But we actually started in a bit of a hurry and lost out on public confidence. I'm now chairing the health committee. I'm still going slow and looking. I'm not talking much these days because I want to see what exactly is happening. If we mean that we want to improve it, it will. But if you are saying it because we want to, as public relations, it won't work. And I want to say in this country at political level, we must cut out public relations, talk less, and start working and have services to work. Why did SHA start with the problem? Because there are 3 funds, but we in a hurry, we started with 1 fund to take care of 3 funds. It is now we are actually putting in the second and the 3rd fund. But what about how we manage the human resource? Look at the transition. We are moving back and forth. Now you are all NHF staff are going to SHA. Now they are not going. Now they are going at this. We must be consistent and move in an orderly manner. Forget about public relations. If it is good, it will look good. Don't keep saying it is good. We want to do good. Just let good be done. As chair of the health committee, I'm in the process of learning. I'm not talking yet. There's a process of learning. But I think the most important thing, we can have all the resources we need, but do we mean it? what carries the day when we are running services? Is it politics or business? If business and politics carry the day, our health services will not improve. That is really where the problem is. As leaders, we must have integrity. We must cut out public relations and just do what needs to be done. So this, in principle, is good and can be popular. But let's look at the other element. Can you really force people with the constitutions you have today to actually use public facilities against their will? So Speaker just asked whether that can be done. So I think this is a good debate we should have, and I support the debate. The motion, we can pass it, but if you really want to go, then there will be even human rights issues in it. So what I think we need to do as leaders, we find ourselves, is deep inside us. This money we have put everywhere. Let's look at education. Amze asked me over the weekend, you people are telling us there is no money for university. Now all of us know there are ambassadors everywhere to raise money for kids going to university. And we said we are going to fund university education. Amze asked me, you people are telling us there is no money and you are going with these aeroplanes. He asked me, how much does a helicopter take to hire in a day? I said about 500 million per day. And he said, my child needs just about 100 or 100,000 shillings. One helicopter in one day will pay for 10 kids' university throughout. So there are issues we need to look at. So we can do it as a country. The design of SHA, if we leave out politics, we leave out business, and we look at the facts of the matter and listen to professionals. Politicians should guide the country and let professionals do the work. That is what will bring change. Not that we say this, at the same time we are looking at business, how we will make benefit when drugs come. Look, KEMSA has a problem, and most of the bills KEMSA has is in government. County governments owe KEMSA about over 2 billion shillings. National government, the ministry of itself, owes KEMSA money. And now we have given KEMSA 1.5 billion. But if we owe it 3 billion, but we are giving it 1.5. If we just paid that. So I think this is a good bill. It is raising issues that we should look at. But the thing we need is to be sincere as leaders and look at what is good for our people. Then it will work. Health can be improved. It was working before. Public sector was working in health, in education, in everything. We can do it. Let's change the politics. The politics of pursuing power and not caring what people are getting, that is where we are failing. Mr. Speaker, I say this is possible, but let's look at the politics of the country. Thank you, Mr. Speaker.
The Honorable Njikal, because you told us before that the SHA was part of your brainchild. You've told us in this house before. I was wondering, if you want to have this policy, this just one matter that you do and this works. Scrap all private insurance for public officers. If you did that, then everyone reverts to public. Members, join me welcoming children from Kamwimbi Primary School, Chuka Gamangombe constituency, Tharaka-Nithi County. They are sitting in the speaker's gallery and they are welcome to follow proceedings this afternoon. Member for Endebess. And after the member for Endebess, this is how my list looks like. There's Honorable Martin Owino, Honorable Nyamai, Honorable Zamzam, Honorable Ferdinand Wanyonyi, and then Haroli Omondi, like that. So I will follow it. You remember, I just request your patience so that everyone gets their chance to have a say on this. The member for Mgwen, you don't have a card today. You have to get a card.
Thank you, Honorable Speaker. Honorable Speaker, I want to support this motion. The Honorable Sabina Chege puts it that therefore the House resolves that the government through the Ministry of Health, because that's our prayer, implements the Kenya Universal Health Coverage Policy 2020 to 2030 and introduce a policy on mandatory use of public health care facilities by all civil servants, public officers, and state officers in the country. I think that is the gist of the motion. Yeah, okay. Unfortunately, she has no card. But
The honorable member for Endabes.
yes.
The move of the motion says she has a point of order.
Yeah,
what is out of order? Sit down. Take your seat. What is out of order? The member for.
Mr. Speaker, I noticed and I shared with the clerk about the end of that statement, and I know that's where honorable member is going to, that the government through the Ministry of Health implements the Kenya Universal Health Coverage Policy 2020-2030 and introduce a policy of mandatory use of public health care facilities by all civil servants, public officers and state officials who, that one I noticed was missing in our order paper, and I told her, who are using medical cover catered for by the government of Kenya. That one was missing, Mr. Speaker, and I shared with the clerk at the desk. So, and I want to make a clarification, the public officers and state officers who are using medical cover catered for by the government of Kenya.
Okay,
so you're not limited.
We'll seek clarification and amend accordingly.
Please.
So proceed, honorable member for Endabes.
Thank you for that amendment. I hope that, I don't know procedurally, it should have been amended before. Procedurally.
We shall proceed with the debate.
As
Then
it is.
We'll retrieve the motion as approved by the speaker, then we'll amend at that time.
Okay.
But proceed.
But I'll be able to, I'll now move my motion the way it is in the order.
Go ahead.
Okay, thank you, Honorable Speaker. So, Honorable Speaker.
In any case, the honorable, because you know that you can actually even amend the motion.
Yes. Okay, thank you, Honorable Speaker. Honorable Speaker, this issue about universal health care coverage, which the Kenya Kwanza government introduced through 4 bills that were brought into this House, and this House passed. Honorable Speaker, with those bills being passed, we are aware that SHA has 3 funds: the Primary Health Care Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. And these funds, Honorable Speaker, have been operational right from October last year. And the Kenyans, we've seen the people coming out and sharing their experiences where many people are benefiting. And as we progressed, depending on the absorption of the funds, we've seen that there is enhancement of the emergency, critical and chronic illness fund. There is enhancement of primary health care fund. And this, Honorable Speaker, is going a long way in improving the services within our health facilities. To me, the only challenge has been support from the county governments, because when you talk of level 2, level 3, level 4 facilities, some of them have been slow in terms of registering and providing services to the wananchi. Some of them have had challenges in terms of, even as counties, in terms of paying KEMSA. And this contributes to availability of resources within those facilities. But if the county governments embrace the primary health care fund, which is available for them through the FIF, they must be able to provide all the necessary services within level 2, that's the dispensary, level 3, the health center, and level 4, the outpatient sub-county hospital. And that means Mwananchi will only be able to walk in and walk out with all those services. because this House, Honorable Speaker, appropriated around 11 billion in this financial year, and in the last financial year, in the initial, we appropriated 4 billion, and subsequently in supplementary, we also added another 3 billion. That means services at those levels must be able to be provided without any serious challenges. But as put by many of our colleagues, one of the biggest challenges between private facility and government and public facility is the level of cleanliness. And I think that is where we should be able to begin from. For some of us who worked in county hospitals, I worked in Baringo as a medical superintendent and also as a medsup, as an MOH in Elgeyo Marakwet and also Marakwet. Honorable Speaker, some of the services which people can testify is that we made sure the hospitals are clean, and in most cases, people would even prefer to come to government facilities. As we speak even today, for some of us who trained in Kenyatta National Hospital, I think anybody would be comfortable being treated in Kenyatta National Hospital at any time. Same to Moi Teaching, same to Kenyatta University Teaching and Referral Hospital. I think it is just a question of our change of attitude, so that you walk into these facilities and you will be able to get any treatment. At one stage during President Mwai Kibaki,
The Honorable Waluke.
an issue of
Order. The Honorable Waluke. The Honorable Waluke, talk to your friend. Tell him do the right thing.
Honorable Speaker.
If that's the Honorable Obiri, or you know what to do. Go ahead.
Honorable Speaker, at one stage, governments introduced what we call amenity within public facilities. Because at that, many Kenyans at that stage, they would prefer a more cleaner environment. They want maybe a private room. And these are available within government institutions. So I think it's a question of your attitude as an individual. Today, as we speak, anybody in Eldoret would be very comfortable being admitted at the Moi Teaching and Referral. I think it's the best facility, and it's a public facility. So, to me, I think it is just that maybe some bit of prestige where people think maybe if I'm treated. I'll give you an incident, Honorable Speaker, that I went to one of the private hospitals 2 days ago because I was cleaning my ear, and the ear part, the cotton wool, entered into my ear canal. And I went to one of the hospitals which is accredited by Parliament. They were not able to do it. But when I went to a public hospital, that was done. It was done in a few minutes, and I left and came back. Okay? I wouldn't want to mention it for just not to discourage any patient from going there. But it shows you that because when I went to that private hospital that is accredited by Parliament, I was told they had to wait for the consultant ENT will have to come on a Tuesday, and this was a Monday. Yeah. While when I walk into the public hospital, it was done immediately because the doctor were available there. So at times we tend to blame our doctors that doctors in private hospitals are not available. It's maybe on that day where they are booked to work to go and work in the private hospitals. No, in the private. But in public, they are available there. In fact, you have more of them there, even both senior and even those who are registrars or they are in training. So this motion where we are resolving, that we make it mandatory for every public servant. I don't think it's in good faith to me, the way it is. It is in good faith that we must create trust within our public institutions, that we can go there, you'll be attended, and you'll be able to get the best services. Just like on Monday when I got a good service in a public facility. So, Honorable Speaker, this is a good motion. I think many Kenyans should look at it from a positive point of view. Occasionally, when I'm at home, I go to Endebess Hospital to do operations there. And I pro bono, I don't charge anybody because I'm a member of parliament and paid. And those services that we provide are quality services. And we mentor the young doctors to make sure that this country attains at least this universal health care. With those few remarks, Honorable Speaker, I want to support.
This chance goes to the member for, before the Martin Owino, Honorable Martin Owino, there's member for Elgeyo Marakwet. Then Honorable Martin Owino.
Thank you so much, Honorable Speaker, for giving me this opportunity. And one, I want to actually appreciate the Honorable MP, Honorable Sabina Chege, for bringing this motion to this House. Mheshimiwa Speaker, I actually am a subscriber of the public utilities, public hospitals, public schools, because that is where every Kenyan can afford. And that is where the regulations and good policies are, unlike private institutions. And at times, Mr. Speaker, you wonder why government institution or public institution use taxpayers' money to pay very expensive and very exorbitant private hospitals after getting the money from the public coffers. And yet the services offered in the public and the private hospitals are the same. The only difference, or what I can say is, what brings the difference at times, is you find that the public hospital, the management of the public hospital, it's not the doctors, it is not the services, not the drugs, it is the management of public hospitals that is wanting. You find a public hospital, the moment you enter into a public hospital, there is a synonymous smell. There is something that actually notifies you that you are now entering a public hospital. It is not maybe it is not something you can associate with drugs or anything clinical, but it's maybe something of that and disposed waste or something like that. So, Mr. Speaker, now that the public hospitals are devolved and they actually with the county governments, I want to urge the governors, because if from where I sit or from the response of the people of Elgeyo Marakwet, SHA is working with us. And the chair for health has just said that it doesn't work with him. Maybe it's because the hospitals in his area or the people, there are no facilities in his area that can actually accommodate the people who want to use SHA in the public hospital. Or the criteria, maybe they were not guided well on the parameters of what people should pay. In that when people feel to be enrolled in SHA, they get a very exorbitant amount of money, maybe 1,000 shillings, and you find them giving up. But if they are guided well, the mama mboga in the village and the local farmer should pay not more than 630 shillings. So most of the people are registered with SHA. Unfortunately, when they go to 6 services at the level 2, at the level 3, level 5 hospitals in the county, they don't get sufficient services because you find there are no drugs, there are no doctors. That is not the failure of the health practitioners. It is the failure of the management of those hospitals. So if the county governments can up their management a little bit, they get stationed person there, the superintendents there to ensure that people report on work, there are drugs, Even the public hospital should have more drugs than even private ones, because the private, they buy, where these ones they procure from KEMSA, and KEMSA, we know they have even the drugs in excess. So I support this one, but as much as I support, also somebody must do their job. That is the county government. They ensure that they are thoroughly cleaned, because that is the hygiene actually that is putting people off. Unfortunately, Mr. Speaker, somebody yesterday forwarded me, and I'll say it's Baringo County. Somebody forwarded me a patient in Baringo Hospital who was in hospital bed. Though the context was not to look at the service that the patient is getting, but he was telling me there is a reported unknown disease that has been reported. But that person was feeding on a lid of, and it was all over social media, buckets, the hospital bucket. You see the bucket that people normally carry to go and wash their clothes, and it's green in color. So that person had utilized the bucket to go and fetch beans and ugali there, and it was a green bucket. So you can imagine somebody who is a public servant, or me as Mheshimiwa, Mr. Speaker, or even a primary school teacher, or even a secondary school teacher, or a doctor, like Honorable Nyigal and Honorable Pukose, being admitted in an hospital, then you find them feeding in a plastic, not plate, lid of a bucket. I mean, buying or acquiring even the very cheap plates, the very cheap necessities, the plate, the bucket, the spoons in an hospital, in a public hospital, should not be at all order. Some of those patients, when they are coming to hospital, they are not anticipating that they are going to be admitted. Some of them are even collected by well-wishers because of the motorbike accidents, and they are just dumped there. They cannot buy them anything to use it there. So I think the governors should just try to make sure that they make it a little bit decent, so that the public people can use it. Otherwise, I am an advocate that the public institution should pay money to public institutions to ensure that we are improving the public institutions. That is where we ended up with education in Kenya. It almost got privatized, everything, because people started pouring money into private institutions, and then the private institutions gave extra time to teach. And even the teachers who used to teach in public institutions started paying more money for private teachers who are not even at times trained. They just get somebody who qualified in Form 4, got an A, they go and teach your children, and you pay them a lot of money to teach your children. Here you are a professional teacher, maybe 20 years, 30 years in the service, but you don't even believe yourself that you can teach your child, not even in school, even at home, and pass exams. And we ended up wasting a lot of money, and people ended up becoming very poor because now public institutions were dying. So, Mr. Speaker, I want to support the motion by Honorable Madam Sabina Chege by saying we should actually ensure that the public institutions make it a priority, public servants make it a priority to go to public institution. But the disclaimer that I still give is that the public hospital should also try. And most of those teachers, all the doctors actually in private institutions still practice in public. And at times I wonder, why can they go and call the management of public hospital and even show them how a private hospital looks like and how a public hospital looks like, because they are actually two worlds apart. Thank you, Mr. Speaker.
Thank you. All members, in the public gallery, students from Karirikania Comprehensive School, Kuresoi North, Nakuru County, and students from Digital Junior Educational Center, Embakasi West, Nairobi County. They are welcome to follow our proceedings this morning and to the Houses of Parliament. Next, I think is the Honourable Member for Ndiwa.
Thank you, Mr. Speaker. I really appreciate this time to contribute to this. And Mr. Speaker, from the onset, I want to thank my former chair, Sabina Chege. We used to call her Maito. I'm happy that you are still on top of these issues of health. Mr. Speaker, the most important facility, health facility, for all of us members of Parliament, is the facility next to your home, whether it's a health center or a dispensary. That is a public health facility. Whether you are bitten by a snake or you have diabetes, shock, or you have heart attack, or anything, that is the facility that you will stabilize your health. Many times we are saying, which is true, that health is devolved, and we leave it to the county government. But I want to challenge ourselves, because with the arrangement we have now, where health is starting from level 1, where community health promoters are, to level 2, level 3, 4, and 5. We have to get involved, because that management we are talking about, which is okay. In health, in a dispensary, there is what we call dispensary management team that oversees the FIF, which we have already put in place. These are the people selected within our surrounding, and others are expert with them. I think we should also be concerned how they are working and what is their concern, so that they can manage the funds that we are giving now, which is, to me, which is more adequate than we had before. And that is the PHC, and the chronic, and the KEMS arrangement with them to have drugs. All these are managed in those facilities. And the people who are important are those committee members, because they budget and they push for execution to the counties. Just like the schools are run, the BOM and also the teachers by the TSC. We have to be involved. If we could get involved as 349 members of this House, we can get it better. Mr. Speaker, access, quality, and affordability of health is very important, because they all address preventive and promotive health. In fact, if we are talking of funding, we should talk more of funding this preventive and promotive health. Right now, people are showing up in higher facilities with complicated cases. Let's say cancer, level 3, level 4. Diabetes, people walk, they don't know, people walk sick, but they don't know that diabetes is really ravaging the organs. When they show up, they are done. Pressure, same thing. So the funds which we have allocated as the committee are addressing also preventive and promotive health. What is lacking, which we want to see happening, is equipping those lower facilities with the equipment that are relevant to what we are saying. So when you get there, you can get the treatment and the services that we deserve. To me, in a way, that will mandate people to go there. You know, you have to promote, you have to market for things for people to buy. Once we do all those things and people can walk in and get the services, they will not go to these private facilities. The other thing which is very critical is the issue of human resource for health. You remember the US government withdrew so much money, which were employing our staff in these facilities. To an extent that you can find a health center with 2 nurses. When one goes on vacation, when one goes on training, the facility is almost closed. More so, the time for our services. Healthcare is not 8 to 4 issue. Healthcare is 24/7. Because I don't know, somehow, this critical illness comes at night. And we talk of level 2, level 3, they are not functioning because there is no personnel. So at least when we talk of funding from the health committee, please agree with us even to increase it to the Abuja declaration of 15%. We are still now at 6-7%. And now that was running because there was another help from the US government. Right now, we are almost on our own. As I said, if we increase the preventive and promotive services, we will have quality of care, and quality of care will reduce disease progression. What kills Kenyans now is lack of quick attention and referral to services so that the diseases progress. Honorable member, you will agree with me, it's not only in Dewa, but crude death rate is now the highest. You attend funerals every week in 10s, 20s. Why? And it's not age specific nowadays. Even young people, when all the times when you hear evolution of cry, you will think it's an old man. Nowadays, it's across the board. And mental issues have even complicated it. So what we are saying is that if we can deal with disease burden at the primary levels, at rural settings and slums, we can prevent many diseases from progressing, and also we can prevent mortalities as we watch it now. The issue of SHA, we are dealing with it now, and SHA must work. And SHA is working in many areas. In my constituency, I've just found out that the impedance right now is the demand to pay for the full year. That money people do not have. And I think we have talked with the CS to look into it. And by the way, a member of parliament, we have a very energetic, one of us who was here, who is now the CS. We're working with the committee very well. They have to reduce that payment to either monthly or bi-monthly or 4 months. Because if I'm a member of parliament, I'm paid, and my contribution is monthly. How dare we say somebody who has no continuous income to pay per year? So that one is being sorted out. The other issue which I found in SHA is that people are still being told to pay some fee for books, for data, why do we have to go writing people on paper, and we have gone paperless? In fact, we appropriated money here for digital superhighway, which should now be cascaded, and those facilities should be empowered to have computers and go digital for people to appreciate why we have put that money. The time of paperwork and all this is gone. Let's go digital. Mr. Speaker, the other issue which I would need your help as Speaker of this Assembly, community health workers. I think Dr. Pukoz is the one who said that we need to have change of mind. Health-seeking behavior is not automatic. It will not come automatically. People have to be motivated to go to the facilities, even if they are not sick. Because there are so many walking sick. There are some symptomless diseases that you can only find when you go for a checkup. Community health workers is the key driver of UHC. Madam Sabina, you know that very well. We had this bill here and passed it last term and sent it to Senate, Mr. Speaker. That bill died in Senate. Through the wisdom of our substantial Speaker, we resurrected that bill, and it was passed here. And I want to appeal to this House. It is now 7 months in the Senate, and it's likely to die. But that bill will streamline all the operations of the community health promoters and how they should be compensated and equipped, and we will prevent so many diseases if we find them on time using these wonderful people. So I have asked my chair, and I'm asking the leadership of this House that we always pass many things for Senate. They should look into this bill and pass it immediately. Mr. Speaker, with those few remarks, I want to support this bill and encourage this motion and encourage all of us to support it too. Thank you.
Thank you. Member for Kitui South.
Thank you very much, Honorable Speaker. My friend seated next to me came in when you were about to give me a chance to speak. And he told me, tell me, in quotes, dunia iko namna gani? So before you called me, he had just started engaging me. So, Honorable Speaker, let me address this important subject before now I settle down to tell him, dunia iko namna gani? Honorable Speaker, first of all, I would like to congratulate the Honorable Sabina Chege, who has decided to come up with this very important motion. And Honorable Speaker, this is a very interesting house and a beautiful house to be. because today, as we sit, Honorable Speaker, we have the Honorable Fatuma Chege. He was a chair health, and he did a lot of work. Honorable Sabina Chege. Honorable Speaker, I also sat on that seat as a chair health, and we did very good work, and we laid a lot of ground for what is happening today. And Honorable Speaker, in that committee, we had the Honorable Dr. Nyikal, the current chair health. And he was an extremely important member, and he was also useful in laying ground to what is going on. And we have the Honorable Dr. Pokose, also who has been a chair. And he has also done very good a job, now seated in Budget Committee. And I think this is the beauty of longevity in the House, at least sitting in this House, not for one term. Because sitting in this House for one term, Honorable Speaker, it leaves a lot. You miss a lot. So having these members who sat for more than one term, it is very important to have them debate on this motion. Honorable Speaker, this matter of UHC is a matter that I would like to take this opportunity to congratulate the President for his boldness. This started with the 3 former governments. The time of Mzee Kibaki, he really wanted to implement UHC during the time of Ngilu. But the boldness to go to say, let's pass the law, let's go for it, did not happen. We also had the time of Anyang' Nyong'o, when the President really wanted to have universal health coverage. There was no boldness to say, let's go for it, let's pass the law. We were here, Honorable Speaker, during the time of Uhuru Kenyatta, and the desire was there. But to have someone to say it's time to go for it was not there. And so this is one of the reasons as to why I'm saying I would like to congratulate the current President for being bold, for not caring about the processes that it takes, but just to say that this is the time that we must give dignity to Kenyans, ensure that we have an opportunity for everybody, disregarding their economic situation, disregarding whether they voted for him or not, disregarding their geographical location, to say that we must implement laws that ensure that if a person is sick, they can walk to a health facility next to them and get treatment. So this is something that we must congratulate this government for and do our best to make sure that SHA works. Honorable Speaker, before I talked about this, I had an engagement with the Honorable Dr. Nyikal, and he has told me that it is possible. I have looked at the laws, and I know, Honorable Speaker, that now we have a possibility of having level 1, level 2, and level 3 being free, and also level 4. And also, we have the other levels being funded through SHIF. Honorable Speaker, what is important now is to ensure that we have the right equipment, we have the right products, even the consumable products at our local centers, such that someone does not go to a health facility and is told that the blood pressure machine is not working. Luckily, we also have, initiated by this government, the community health workers who are walking around our villages and having a very good collaboration, initiated by the national government, between the national government and the county government, that we have community health workers who are able to walk around our health facilities carrying those gadgets, which are extremely important. So, Honorable Speaker, I would like to say that this is the opportunity that Kenyans should not lose. And Honorable Speaker, in the 12th Parliament, we visited Japan because they have a very good way of dealing with the universal health coverage within their 47 prefectures. Honorable Nyikal, help me if I didn't get that very right. But they also have similar to our counties, and they are 47. And for them to be able to implement universal health coverage, they made it like compulsory and said that before you buy anything else, please remember your health. Remember your health. And it became a culture that in Japan, health is free, but they did not just enjoy it the way they enjoy it now. It had to be by force. That if you are a farmer when you get your products from the farm, the first thing you give is take care of your family health. The health of your family by ensuring that you have contributed to the universal kitty for universal health coverage. So, Honorable Speaker, this is a very important time we have, that we must make sure that SHA works. We must provide the necessary budgetary allocation for it. We must encourage collaboration between the national government and the county governments, because no matter how much money is provided from the national government, when it goes to our counties, our governors are the ones to make sure that everything works, to make sure that our nurses are comfortable, to make sure that our doctors are comfortable and they are happy to go to a clean hospital, to make sure that when they get there, they'll be able to get all the products that they require, including all the equipment that they need and all the other facilities that go with it. Honorable Speaker was encouraged to know that there is direct support to KEMSA now. That KEMSA will not just wait for the county government to purchase drugs, but drugs can flow from KEMSA to the counties so that the counties can now send those drugs direct to level 1, to level 3, and to level 4. And I want to hope that governors are excited as we are, so that they can make sure that this does not fail. Honorable Speaker, something else which excites me is the engagement that I saw the Honorable Duale having with the leaders of the health workers. And for the first time, I heard their leadership saying that we have been meaningfully engaged. This is something that we have been looking for. And it tells us that members of this House who get to the position of cabinet secretaries are doing a wonderful job. And it is good to give flowers when someone is there. This House, Honorable Speaker, I speak today to say that Honorable Duale is doing a good job by encouraging the health workers, a wonderful job. We saw him recently talking about the cost of healthcare and talking about having poor quality drugs in our hospitals. Some cabinet secretaries would never have wanted to go to that engagement because maybe they were also part of the problem. And I want to encourage him to go for it. Make sure that our doctors are happy, our nurses are happy, our general health workers are happy. Make sure that the technology that is in those hospitals is adequate, and make sure that we have good quality drugs, because that is what will get us where we want to go. Mr. Speaker, this government has also ensured that we have emergency healthcare and treatment for chronic diseases. And I know that not many governments want to go for it, and that's why we are saying that boldness is important in the presidency. And His Excellency Dr. William Ruto has decided to be bold, to say that this looks difficult, but I am going to say that when someone needs emergency care, whether it's through a road accident or it has happened somewhere in the streets, they must be picked and nobody should ask them whether they have any form of insurance. They should be taken to Kenyatta National Hospital. So looking at my time, Honorable Speaker, I can say my time is over. But I want to say one thing. As we look at UHC, let us all look at the other bar. That other countries are now talking about longevity of life. And it is a big discussion. And we would like to ask the Ministry of Health not to fear. Let us talk about why other countries are now going to talk about people living beyond 80 years and having a good quality life. So we must look into that and go to the scientific knowledge and the social knowledge so that we can join Team Kadesia. It's called Kadesia, the one you are telling me about, which I'm going to engage him on now, Honorable Speaker. Thank you very much.
I didn't know the kind of things you discuss with the Honorable Thuku are terrible like that. The Honorable Member for Mombasa, Honorable Chimba.
Asante sana Mheshimiwa Spika, na mimi niweze kupigia upatu mswada huu ambao umeletwa na dada yetu Chege, na niweze kusema kuwa Mheshimiwa Spika, mimi niko katika kamati ambayo inaangalia maslahi ya wananchi, ambayo inatoa ulinzi katika maslahi ya wananchi, yani social protection. Na Mheshimiwa Spika, mimi napenda kusema ukweli. Afya bora kwa Wakenya wote ndio ruwaza ambayo alikuwa nayo rais wetu wa taifa Dr. William Samoei Ruto. Na ameweza kuhakikisha kuwa akisukuma masuala ya SHA ili Wakenya wote waweze kupata afya bora, Mheshimiwa Spika. Lakini pia naweza kusema kuwa katika hospitali zetu za kaunti ambayo kuwa tunaangalia masuala ya afya yameweza kupelekwa katika ugatuzi, Mheshimiwa Spika, wao ndo ambao wanamwangusha rais. Na mimi naweza kusema tumeangalia juzi masuala ambayo yanaendelea katika hospitali ambapo kuna mgonjwa, kwanza picha imepigwa kitanda ambacho amelalia, Mheshimiwa Spika, ni sehemu chafu sana. Na kama alivyosema msemaji wa kwanza, Mheshimiwa Spika, ukiingia katika hospitali zetu za public, harufu kwanza inayokupiga, hiyo inaonyesha hata mgonjwa akiingia pale anaona kifo mwanzo, Mheshimiwa Spika. Hapati ile hope ya kuwa mimi nitaingia hapa nitoke nikiwa mzima, Mheshimiwa Spika. Hospitali zetu ni chafu, vitanda vichafu, malazi chafu. Hata mgonjwa akiingia pale ugonjwa unazidi maradufu, Mheshimiwa Spika, wakati serikali kuu imetoa pesa nyingi sana kupeleka katika ugatuzi kuhakikisha kuwa haya mahospitali yanafanya kazi na yanatoa huduma bora, Mheshimiwa Spika. Mheshimiwa Spika, mimi napenda niseme wazi, yule mgonjwa jana nimemuona hospitali, kwanza nguo alizovaa, Mheshimiwa Spika, nguo chafu. Mimi nakumbuka wakati wetu miaka ya nyuma ilikuwa sisi tukilazwa hospitali ambao ni ya public, tunapata zile uniform ambazo tunavaa za hospitali za wagonjwa ambazo ni safi, zimeoshwa na dawa, vitanda viko visafi, malazi masafi. Hata ukiingia hospitali unajua daktari akija kukuona unapata ile hope ya kuweza kupona, Mheshimiwa Spika. Lakini kwa sasa hospitali zetu za kaunti zimekuwa ni hospitali ambazo zinanuka, zina uchafu. Maiti yuko pale amekufa, mgonjwa yuko hapa anamwangalia, hana ile hope kuwa mimi nitapona, na muona mwenzake yuko pale na hali ambayo yule maiti yuko pia ni hali tata sana, Mheshimiwa Spika. Mimi nataka kusema gatuzi zetu, na hata niongelee kaunti yangu ya Mombasa, tumekuwa na wagonjwa ambao wanakuja ofisini kwangu, Mheshimiwa Spika, wanakuja na makaratasi ya bills za hospitali, bills kubwa kubwa, wanaomba kusaidiwa 100,000, 200,000. Mtu amelala hospitali wiki moja na kuambia mama niko na SHA, lakini naambiwa hii itakava hizi pesa zingine zote nitafute nilipe. Mtu pengine aliumia mguu tu peke yake, Mheshimiwa Spika. Sijui ni corruption inaendelea katika hizo hospitali, lakini mimi nataka kuambia hawa magovernors wetu hawawezi kumregesha rais nyuma. Sisi tukiangalia rais amefanya bidii. Duale, ukiangalia wizara ya health, waziri anaenda mbio juu na chini kuhakikisha kuwa Wakenya wanalipa SHA, na Mkenya akilipa lazima apate huduma bora, Mheshimiwa Spika. Haiwezekani kuwa Mkenya amelipa na hata wafanyikazi wetu wa maofisi wameenda, mtu ana pressure iko 200, karibu itampasua kichwa, lakini akienda pale anaambiwa cover yako haiwezi kukusaidia hapa hospitali, wakati amelipa SHA yeye mwenyewe. Ofisi ya mama county pia imemlipia SHA, lakini huduma hawezi kupata, naambiwa toa 5,000, toa 6,000. Pressure, ugonjwa wa pressure, Mheshimiwa Spika, ambao mtu anaweza kuanguka pale akafa, Mheshimiwa Spika. Watoto wadogo sisi tunaona katika mikutano magavana wanazunguka wakisema mtoto chini ya miaka 5 atatibiwa bure, lakini urongo. Wakienda hospitali, Mheshimiwa Spika, hawa wote wanaulizwa pesa. Mtoto sijui anaambiwa mara sijui mashini ya kupima kitu fulani haiko hapa, tunakurifa hospitali fulani. Na tunaelewa, Mheshimiwa Spika, baadhi ya hizo hospitali ambazo hawa wanawarifaa ni zao za kibiashara za kibinafsi, Mheshimiwa Spika. Na ndio maana tunasema ruwaza ya rais ya kutaka kuleta afya bora kwa wote, kwa jamii, afadhali ifuatiwe hiyo, Mheshimiwa Spika. Mimi mbunge niweze kuingia Makadara nipate huduma, yule mtu wa chini aweze kuingia Makadara na yeye pia aweze kupata huduma. Hivyo ndio maana Kenya itakuwa sawa na tutawacha kuangalia kelele za barabarani, Mheshimiwa Spika. Mheshimiwa Spika, nikiweza kuzungumzia masala ya wale CHVs ama CHWs, hawa ambao wamejitolelea kufanya kazi ya afya, Mheshimiwa Spika. Ukiwaangalia na hata ile budget ambayo county governments tumewapa, Mheshimiwa Spika, hawa watu wanatembea hawana gloves, hawana magwanda ya kuvaa ya kazi, wanaenda kuhudumia watu maradhi ya maambukizi. Kama juzi mmeona Mombasa, maradhi yametokea ya aina ya kiajabu ajabu, Mheshimiwa Spika, mpaka mtu unaogopa hata kumtoa mtoto wako kwenda shuleni, Mheshimiwa Spika. Nakumbuka wakati wa ugatuzi wa kwanza, yule aliyokuwa gavana wetu wa kwanza, Mheshimiwa Hassan Ali Joho, aliweza kuboresha afya ndani ya Mombasa, Mheshimiwa Spika. Tulipata vifaa vingi sana, na mimi nataka niwaambie magavana, sio lazima tu ufuate serikali peke yake, kuwa mbunifu. Kuna NGOs, kuna watu wanataka kusaidia. Nyosha mkono wako, waambie hiyo hospitali yangu hapa naweza kupata kitu fulani. Hassan Joho alikuwa mbunifu sana, na tukaona hospitali ya Makadara iliweza kung'ara Kenya nzima. Ilikuwa na vifaa hata wakati wa corona, Mombasa ilikuwa namba 1. Lakini kwa sasa, Mheshimiwa Spika, chikungunya iko kila mahali Mombasa. Kila mtoto anaugua, kila nyumba kuna maradhi ya chikungunya. Kwa sababu gani? Hata kwenda kuweka ile kuspray yale madawa ya kuua wale mbu siku hizi pia hazifanywi. Mheshimiwa Spika, ruwaza ya rais lazima iafikiwe. Ruwaza ya rais na bidii anayofanya, lazima wale walioko chini wahakikishe kuwa wanafanya. Na Mombasa imekuwa namba 1 katika kukusanya pesa za SHA. Lakini ya kusikitisha, sijui kama gavana anajua, pale hospitali watu wanateseka sana. Unapata mtu ameingia hospitali leo, alikuwa na SHA, amefariki, maiti imekataliwa kule mochari. Anaambiwa anadaiwa pesa. Wale watu ni maskini, hawawezi kulipa pesa ya mochari. Na ndio juzi tumeona hata katika televisheni wakitangaza kuwa kuna hospitali, nafikiri ilikuwa hapa Nairobi, wanaenda kuzika miili ya watu halaiki. Hawa watu, Mheshimiwa Spika, sio kuwa hawana familia. Hawa watu ni maskini, wamekosa pesa ya kuweza kulipa pale hospitali, Mheshimiwa Spika. Wakati ambapo rais ameweka wazi na Wakenya wanalipa SHA. Wakenya wamejitolelea, wanasema wacha nilipe itakuja kunisaidia. Lakini wakienda kutafuta huduma ndani ya hospitali, wanaambiwa lipa kitabu, sijui lipa nini. Hata wakati huu ambapo tuko na mambo ya teknolojia, ambapo kwamba unaweza ukarejista mgonjwa katika kompyuta yako, anaambiwa nenda ukatafute kitabu. Hicho kitabu anaambiwa ni karatasi ndogo hivi, Mheshimiwa Spika, lakini anaambiwa lipa shilingi 400 ama 200. Mgonjwa ametoka nyumbani, hakuna mtu ambaye anaita ugonjwa katika maisha yake. Ugonjwa umfuata mtu yoyote, awe maskini, awe tajiri, Mheshimiwa Spika. Kwa hiyo mimi nataka kuambia magavana wetu, juzi na jana tumewaongezea pesa 415 billion. Tunataka kuona huduma kwa wananchi, isiwe wananchi wanazunguka, Mheshimiwa Spika, wanalalamika wakimpiga rais, wakati kuna watu wamezembea kule mashinani, Mheshimiwa Spika. Rais hawezi kutoka hapa akaingia hospitali akajigeuza daktari, akajigeuza mhudumu ndani ya hospitali, Mheshimiwa Spika, ama akajigeuza gavana. Lazima waangalie management yao ambao wameweka ndani ya hospitali. Je, inaangalia wagonjwa vizuri? Hospitali ni safi? Wagonjwa wanapata chakula kizuri? Unaona mgonjwa ameenda kuchukua ndoo ya kuogea, ndoo imetoka chooni, lakini hana hata sahani ya kuwekea chakula, anaweka kwenye ndoo ndio aweze kula. Mheshimiwa Spika, hii ni aibu, ni aibu kubwa. Na mimi nataka niseme KEMSA sasa imeletwa mpaka kule mashinani. Yale mahospitali madogo madogo level 1, 2, 3 and 4 wanaweza kuoda dawa zao, ili hao wagonjwa wa Kenya wasikose dawa kule. Hospitali zile za chini waanze kuhangaishwa, Mheshimiwa Spika. Na hawa pia mapesa zinatoka za SHA na kila kitu, wanunue vifaa kwa mahospitali ambavyo vitaweza kutibu hawa wagonjwa, Mheshimiwa Spika. Naona muda unasi, lakini mimi niweze kumsupport dada yangu Chege kwa kuweza kuleta mswada, na niseme afya bora kwa Wakenya ndio ruwaza ya rais na lazima tuwafikie. Asante sana, Mheshimiwa Spika.
Kwanza Mheshimiwa Ferdinand Wanyonyi, alafu atafuatilia Mheshimiwa Wasuba South.
Thank you very much, Mr. Speaker, for giving me this opportunity. Been sitting here. So given that, I wanted to thank the Honorable Cheke for having come up with this motion. It's very, very important. I think, Madam Speaker, you'll protect me from my neighbors here. First and foremost, I think, as said earlier, public hospitals were even far, far better. And those days, I think you and I agree, we used to go to public facilities. And I think to the extent that, Madam Speaker, would have people coming from as far as Uganda. And I remember some people came as far as Uganda coming to the public hospitals here because we had very good facilities that time. And the doctors, I think there were very many doctors. Today, as we are talking, the problem we are having is actually lack of the personnel in most of the public hospitals. But I can tell you that as far as I'm concerned, the facilities in the public sector, in the public hospitals are very, very good, and some of them are quite good, and some of them are quite old. But the problem we're having today is the notion that when you go to public hospital, as somebody mentioned, they think you are very poor. You can't afford to go to the private hospital. And when in fact somebody dies in the public hospital, then of course you are saying, oh, you know, he was not taken to the right hospital. But I want to tell the public that today, as it is today, we should actually track and make sure that our public go to the public hospitals because there's enough facilitation for the same. And also, the ministry and being headed by Duale is doing all they can to be able to facilitate these public hospitals. And I think let's just change the notion that a public hospital, when you go there, then you are poor. That is notion that will be there, but should not be actually be taken seriously because we have enough facilities, we have enough manpower. The only thing is that sometimes you find the people, the doctors who are working in those public hospitals coming from the private sector hospitals, and they insist that they are paid better. So, Madam Speaker, I think what we should do is, I think this motion has come at the right time. We should be able to support it so that can be able to have enough facilitation. Share today, as most people have mentioned, is working. Yeah. So part of that again should be able to attract most patients to go to the public hospitals. Private hospitals are very expensive, and of course, the same doctors working in the public hospitals and private hospitals are the ones in the public hospitals, and therefore, let's have that. I don't know how we're going to make it, but let's have that as a motion. Let's have our public, note that actually they should be going to the public, like Kenyatta hospitals, for example. In Eldoret is one of the best hospitals, and I think I see most of the doctors who are in the private sector going there on part-time basis. Again, it's something that I think we should be able to attract, tell our students, those who are finishing universities and specialized in whatever discipline, let them be paid well. Be paid well so that can be retained in the public hospitals so that you can be able to meet this UHC so that we can accelerate as actually suggested in this motion so that our people can spend less money because you go to the public hospital. Today, I've just gotten a motion where somebody went to the private hospital I don't want to mention the hospital itself in Eldoret, and the bill is 2.5 million shillings. And they're asking me to take part in settling that. Where do I get that kind of money? Yeah. Yet that person could have actually been done some treatment, better treatment in the public sector. So I think, Madam Speaker, we should be able to sensitize our people and even have our students who are actually graduating to go direct to the public hospitals and be paid even better than those actually who have been told, okay, you must go and work in the private hospital, and so that the public can be able to have the notion that going to the public hospital is as good as going to the private hospital. With those few remarks, Madam Speaker, I support this motion and ask to Madam Mheshimiwa Chege to actually fast track this so that can be able to maybe come up with a notion on how to tell our public to go to the private sector, the public sector, other than them sticking. That when somebody is sick, like somebody mentioned here, that he was, was having a problem and he had to go to the private sector and he was disappointed. So let's have that notion and be able to attract and again sensitize our public to be able to be going to the public sector. Thank you. I support.
Thank you very much. The Honorable Ndindi Nyoro, member for Kiharu.
Thank you very much, Honorable Speaker. Honorable Speaker, I just rise to give a few comments. One is that healthcare is very important for the development of any economy. And actually, Honorable Speaker, in many respects, when we talk about healthcare, education is always just around there, because these are social investments which are basically used to build a good working capacity for any nation. While education adds value, just in manufacturing where it adds value, Honorable Speaker, to the primary produce, what education does is to add value to the working force. But also what healthcare does is actually to service the working force or the labor force. And therefore they are very integral even when you look at it in terms of purity or Puritan economy, Honorable Speaker. But there are issues that continue to handicap, and especially delivery of quality healthcare to our country, as has been said before by my colleagues, one being access, but also number two being quality, Honorable Speaker, and access majorly meaning a cost that is involved in seeking quality healthcare in our country. And Honorable Speaker, the other thing that is critical for us to keep thinking about is that when we appropriate money, we are basically showing the signs on the kind of service we want delivered in the country. And Honorable Speaker, I see it as a paradox that healthcare is actually basically a fully devolved function. But when you look at the appropriation of the money that we give to our counties, vis-a-vis the money that remains in the national government, Honorable Speaker, that leaves a lot to be desired. And I think we need to walk the talk in terms of devolving even the funds and the resources that are needed for our county governments and our governors to be able to provide quality and accessible healthcare in our country. Honorable Speaker, we also have to think about healthcare as dynamic. We have seen in many countries, Honorable Speaker, that R&D budget for healthcare is always adequate, because the challenges that we face in regards to healthcare, Honorable Speaker, is dissipated by new inventions within the industry. And what makes that possible is the budget for research and development, which, Honorable Speaker, can go in many ways. One can be directly provided by the government, but also number two is to give incentives for even private healthcare facilities to be able to invest in R&D by giving them, Honorable Speaker, incentives even around taxes. Because whatever they do, if you get a reprieve which is cheaper and more efficient in terms of provision of health, that then becomes a public good, Honorable Speaker. And therefore it is no longer an asset of the people who invested in it. It becomes a public good for all the citizenry. And Honorable Speaker, that is what we ought maybe to do in terms of policy, that even the private facilities are given an incentive to do better, to come up with better methods, to come up with better reprieve, because ultimately, Honorable Speaker, that becomes a public good. And lastly, Honorable Speaker, it is important that all of us as people who serve the public, that we must continually always show confidence in the facilities that we provide monies for, even in this house. And Honorable Speaker, it's always an oxymoron that most of the public officers have insurances that cover them outside the public facilities. Honorable Speaker, we should be the people who should be championing for quality service in those public facilities. It is important, Honorable Speaker, that all public facilities, and especially those who are covered using government resources, that we show confidence in public health facilities by seeking services there, Honorable Speaker, when they are needed. Because it is in that line, Honorable Speaker, that we are able to see the challenges that happens in the public facilities, so that as we legislate, as we provide resources, we are doing it from the point of knowledge. And Honorable Speaker, that goes in line with many developed countries, including the United Kingdom, where even the public servants, including the Prime Minister himself or herself, in that case, Honorable Speaker, they promote national health services, famously known as NHS. Because when you provide the best quality service there, Honorable Speaker, and you are the one leading the population, then the best way to show confidence is when you need those services, Honorable Speaker, then you seek them from the point where you lead. And since you lead the public, then public facility ought to be given a dab of confidence by channeling all the health officers, Honorable Speaker, to be able to seek services in the public facilities. Otherwise, Honorable Speaker, I thank you for the opportunity and I submit.
Thank you. The Honorable Karoli Omondi, member for Suba North.
Suba Kusini, Suba South. Thank you very much, Madam Speaker.
Let me just take it again for record.
Okay.
The member for Suba South.
Thank you very much, Madam Speaker. I rise to contribute to this motion, not fully in support, but partially in support. I've looked at the motion carefully and I've picked 3 issues that I think require debate. One is the concern that the public healthcare services lack adequate funds to guarantee quality healthcare services. That is very true, Honorable Speaker. I think we have subjected our health sector to chronic shortage of adequate funding over the years, both in terms of facilities development, recruitment and payment of good salaries for health workers, but also investment in terms of research and other activities relating to health sector. So that is very clear. I agree that with that particular concern. And I've just taken a quick look at what happens in other jurisdictions to emphasize that we are underfunding our health sector. In the United Kingdom, the funding for the health sector as a percentage of the GDP, in other words, the economic output of the UK, is actually 9.6% of their GDP. France is 12%, Germany is 13%, Canada is 13%. Singapore is 12%. And I pick Singapore because it has the second best healthcare service in the world, and also the country where people enjoy the longest life expectancy at 84.5 years. But Madam Speaker, I'm very concerned with the 2 other statements in the motion, appreciating that the use of the comprehensive medical cover by public officers and state officers in public hospitals would guarantee sufficient funding for public hospitals. I submit that this may not be so. As you've just heard, the level of spending on healthcare as a percentage of GDP in the other countries, I don't think the insurance schemes that are given to civil servants or state officers or members of public or members of parliament would be sufficient to cover the health service requirements, financial requirements of our country. I don't agree with that, and I would have been happy to see the statistics, but I don't think it is factual. As a matter of fact, I think it would just be a drop in the ocean. But I have a fundamental disquiet and reservation on the main thrust of the motion, that we introduce a policy on mandatory use of public healthcare facilities by all civil servants, public officers, and state officers in the country. Apart from technically being impossible to enforce, I appreciate where this is coming from. As a matter of public confidence, those in position of authority and leadership should actually go to public hospitals. And that is how it is in other jurisdictions. If you go to Germany, 55% of the healthcare facilities are actually public. And by public, I mean publicly funded and publicly owned. Though there's a mixture of what is public. Some are private, some are charitable, some are faith-based, some are university hospitals, and the rest. But in Germany, only 38% of the healthcare facilities are charitable. 55% are public. As a matter of fact, only 7% are private. In the UK, 92% of the population use public healthcare facilities, the NHS. And that is whether you're in Wales, England, Northern Ireland, or Scotland. Only 8% use private hospitals. But you see, they do so not as a matter of legal requirement or as a matter of compulsory administrative action. They do so because their hospitals work. So I think the most important question we should ask ourselves is, why do hospitals work in other jurisdictions, public hospitals, and not in our country? And I think it has more to do with other questions other than this. Second, I mean, most fundamentally, if you try to compel a civil servant to go to a particular facility and they go to court, you will not win that case. Because they are matters of choices, they are matters of rights, they are matters of freedom. It would have been neater to limit the application of the medical insurance for public servants, that you insure for purposes of getting treatment in public health facilities. But if you want to go to seek another option...
Order, Honorable Karoli. I have a point of order by the Honorable Sabina Chege. What is out of order, Honorable Sabina Chege?
Thank you very much. I just wanted to inform my colleague, Honorable Karoli, that I had indicated earlier.
Honorable Karoli Omondi, would you like to be informed by the mover of this motion?
Yes. I had indicated earlier that there was a slight change on the motion, that we, at the last, how it's reading, that let me see where to start. Through the ministry, that therefore resolved that the government, through the Ministry of Health, implements the Kenya Universal Health Coverage Policy 2020-2030 and introduce a policy on mandatory use of public health care facility by all civil servants, public officers, and state officers who are using medical cover catered by the government of Kenya. That bit was missed out, and I hear you, what you were saying. It was about the medical cover and medical cover that is financed by the government. But public officers or civil servants, they have liberty to choose where they can access their medical care, whether they want to go private or public. But if you are using a medical cover catered for by the taxpayers' money, then the first stop should be in the public facility.
Thank you very much,
you may
Honorable
proceed.
Speaker. I thank you for that information, Honorable Sabina Chege. That would be the right approach. However, it would not be right to make it mandatory. It would be an option, so that if I wanted to use my cover in a private facility, then I would be allowed to top up whatever is being charged in the other facility. But I think fundamentally, Honorable Speaker, we have messed our healthcare by devolution. I think I've said it several times here. Healthcare should never have been devolved. Because if you look at the experience of other jurisdictions where health services are working, they are centralized. And if they are not centralized, there are other agencies that provide the health services at the lower levels, but are controlled from a central point at the national level. For universal healthcare to work, which is an insurance scheme, it must be centralized. That is when you have a pool of enough people and enough resources to put together to run a universal healthcare scheme. And I think the good example is the UK, which has the NHS. Even though the NHS, in terms of implementation, is decentralized, it is centralized in that it is fully financed out of the national budget of the United Kingdom. If you go to Germany, they have both federal and local hospitals, but which in terms of implementation are decentralized, but the funding is not decentralized. In Italy, it is centralized. They have something called Servizio Sanitario Nacional. And health provision and health standards and employment of doctors and health workers are centralized. If you go to Norway, they are centralized. I mean, under the Ministry of Health, though they have regional health service providers. The same in Australia, where they charge a medical levy and health is provided at state level, but funded by the federal government. So I think we need to have a thorough discussion. How do we reorganize our health sector within the framework of devolution without compromising the ability to mobilize adequate resources by pooling, and also providing all the health workers with a common employer, just like we have with teachers, so that the standards of quality of service, quality of payments, quality of the personnel is standardized across the country. If we don't need any further research, we know health sectors cannot be run by the counties. It is obvious. If you go to all the county hospitals, you see it happening. The question is, when will this House or the government be brave enough and try and bring back health under a centralized system? And the national health, the universal health service or coverage will not work within the framework of devolution, because they are never intended to work like that. If you look at all the other jurisdictions, and Madam Speaker, I think it is time that we had this debate without burying our heads in the sand, that we will look like we are fighting devolution. We are not. It is important that we give our people universal health cover and a standardized standards of service across the board. Thank you, Madam Speaker.
Thank you, honorable members. Before we go to the next speaker, we have our guests seated in the speakers gallery this afternoon. Students from Linas Wairuru School from South Imenti in Meru County. Let us welcome to the house. Also seated in the public gallery, we have Gesumin Girls Secondary School from Buret constituency in Kericho County, and students from Naibor Amani Primary School, Laikipia North constituency in Laikipia County. You are all welcome to the National Assembly to observe proceedings of the House. I will allow the Honorable Joses Lel Mengit, member for Ingwen, to welcome all students and also make his comments.
Thank you, Honorable Speaker. I would like, just the way you've directed, to welcome all the students who are here today in the chambers from different institutions, and to tell them to feel at home. This is the place where you will be in the future. This is a house of parliament where we make laws, where we legislate, where we represent people and do oversight. This is a learning curve for you, and I also want to thank your institutions for allowing you to come here today so that you can learn one or two and get the first-hand experience here in Parliament. We've been there before, several years back, and we were very determined, we were very focused in our education, and that is why we are here today. So congratulations for coming here. When you go back home, give a good message of Parliament the way you've experienced here today. Thank you, Honorable Speaker. Back to my statement or supporting, Honorable Speaker, I would like to support this motion by Honorable Sabina Chege on universal health coverage to make it mandatory for the public state officers and the civil servants to use public facilities. Honorable Speaker, the biggest challenge that we have currently in our constituencies, a number of fundraisers that we are called to support are on either education or on health issues, related issues, which means this is a critical subject that we are discussing here today, Honorable Speaker. And as much as we would want the government to facilitate for all or cover all the medical expenses that patients incur in this country, Honorable Speaker, resources are scarce. And remember, Kenya is a third world country. We are not a first world country that we can manage to consolidate all the resources and make the healthcare system free. Honorable Speaker, I want to agree with the motion by Honorable Sabina Chege that state officers and public officers should lead by example to get medical treatment from the public institution. That way, Honorable Speaker, we will assist and make these institutions even get funding, especially with the current SHA medical scheme, where specific health institutions receive a certain amount of money based on the number of users using that facility, whether in primary health care or up to primary health care up to level 4, level 5, level 6 hospitals, Honorable Speaker. Recently, I had testimony from one of the administrators in Kapsabet Hospital where he told me, while we were still using NHIF, the amount of money that they used to receive, because they used to receive the money quarterly, Honorable Speaker, they used to receive close to 800,000 in every 3 months. They could not even budget to buy medicine and also buy non-pharmaceuticals. But they have a very good testimony right now, Honorable Speaker, where SHA pays these hospitals or remits money every month. And the money is good amount, close to 3 to 4 million now. So they can be able to budget for medicines, and also they can be able to budget for non-pharmaceuticals, like the gloves, the needles, and make it available in the hospitals. So, and that is within a month. So you see the kind of medical scheme that we have currently on SHA is better than the previous one that we had. Also, Honorable Speaker, we need to lead by example, because this country, the public institutions are failed. They are not being run adequately, be it hospitals or schools, Honorable Speaker, because these two things are conjoined, whereby private institutions are more praised than the public institutions. For example, in schools, Honorable Speaker, the teachers who teach in private schools are the same teachers who undergo the same training with the teachers who teach in public institutions. But where did we miss the mark, Honorable Speaker? I would like to encourage all of us, because as members of Honorable House, that it is possible to make the public institution uplift their standards and get enough or medical treatment that is equivalent to private institutions. So, Honorable Speaker, also pulling those resources together by members of parliament and leading by example will will enable us uplift these institutions to the standards that we want. Also remembering, Honorable Speaker, the civil servants in this country are close to 950,000. These civil servants take a portion of the revenues that we collect in this country by the exchequer, which is close to 1 trillion shillings. As per last year's data, recurrent expenditure of this country is close to 1 trillion shillings. The employed civil servants and state officers are close to 950,000 in this country. All the money that is being collected by the taxpayers, Honorable Speaker, are consumed by only close to 950, barely a million Kenyans. The rest of the 56 million Kenyans, Honorable Speaker, don't enjoy this kind of service. And that is why we want to encourage the civil servants, for the sake of the rest of the Kenyans, to come together, agree on this policy or this statement, so that we can also be fair to the rest of the Kenyans who are paying these taxes. Thank you, Honorable Speaker. I would like to support.
Thank you very much. Honorable members, you notice that most of us are speaking for 8 to 10 minutes. And if you wish, you could make a decision to do 3 to 4 minutes. Then it means more of you can speak. I would like to go to the Honorable Member for Samburu, the Honorable Police Lengoris.
Thank you, Madam Speaker, for giving me this chance to contribute to the motion. And from the onset, I want to support the motion by Honorable Sabina. This is a very important motion, Madam Speaker, because for many years, Madam Speaker, we have been talking about the universal health care in this country. And the objective of the universal health care, Madam Speaker, was to ensure that there is access to the healthcare services, there's affordability, and there was also quality to the healthcare services to the Wananchi. Madam Speaker, and if you talk currently about what the service provision at our public facilities, Madam Speaker, I would not be ashamed to stand here and say that it's worrying, Madam Speaker. The situation is really worrying, and the quality of healthcare service provided to the Wananchi is actually very poor, Madam Speaker. Even after the devolution, and considering even the kind of support the county governments have received from the national government. Madam Speaker, the patients who access services currently at the public health facilities, especially in the place I come from, are really complaining so much. If you look at the health personnel, in the public health facilities, we have the highly trained and qualified health personnel, but most of them, Madam Speaker, are providing services at the private facilities where they will be paid, and at the same time, they are still paid by the government. If you look at the patients who go and queue at the public facilities, most of them will stay to very late waiting for the services at the outpatients, and mostly when they are provided, they are seen by the consultants, they will only be written a small paper and they are referred to go to the private facilities where they could get other more investigations like X-rays, like blood investigations, and even for pharmacies for the drugs that the patient would require. That means, Madam Speaker, that there is a big gap in our public facilities. And the introduction of SHA by our president and the passing of the laws that support implementation of SHA by this House is really coming to be a great support to our health facilities. And I want to call upon the government, the county governments, the governors who are in charge of the county government to give a lot of attention to the healthcare provision at the county levels. Because the introduction of SHA, Madam Speaker, is going to be a relief even to the county government. Because the implementation of SHA is going to ensure that services from level 1 to 4 is going to be free. And the money that is going to be remitted to the health facilities is going to help in the improvement of our facilities, even in procurement of the products or commodities that the health facilities will require. So I want to encourage and ask the governors and the people in charge of the health facilities at the public institutions to be serious, because the provision is poor, the treatment of patients is not acceptable, even the food, the hygiene is really worrying. And I want to ask that this is going only to be possible if the county governments are going to be serious on what they are doing in terms of provision of healthcare facilities. The ones taking care of our facilities at the healthcare, at the county levels, are qualified staffs. So the only thing they require to have is the commitment to the service to the Wananchi. Because what we are seeing now, Madam Speaker, is really worrying. And that is what is encouraging even people to run away from the public facilities. But since now they are getting a lot of money from the national government, they are going to get a lot of support from SHA. The only thing we require is commitment and supervision, and also ensuring that staffs who are employed by the government should first give priority of their services to the public facilities. And this will ensure that the services will improve and our Wananchi will get what they are supposed to get from our facilities. Thank you, Madam Speaker, and I want to donate time for other members who have not spoken. Thank you so much.
Thank you very much. If you can go that way, more of you will speak. The Honorable Jackson Lekumo Ntare, member for Samburu East.
Thank you, Madam Speaker. Madam Speaker, I also want to add my voice in this motion. And Madam Speaker, health is very important to all Kenyans. And we really need to take bold steps, Madam Speaker, so that the Kenyans will get health services. universal health coverage, Madam Speaker, it is required every individual in Kenya to be able to access the health services. And Madam Speaker, there is this issue of CHA. CHA is working, and Madam Speaker, it is not solving all the problems of Kenyans. Even if, Madam Speaker, it is there, but you can imagine, Madam Speaker, Kenyans are going to the hospitals which they are not getting services. Madam Speaker, the health in the country is wanting, and there are no services in these public hospitals. And Madam Speaker, I even interacted with a patient in my constituency who went to hospital, and they were told to go and even get that injection for somebody to be operated. And I wonder, Madam Speaker, even if we make mandatory to civil servants to go to get services there, but there are no those services, Madam Speaker. And I think the civil servants, people are even contributing for their services, and we cannot force people to go where there are no services. And I think, Madam Speaker, the county government must work so that the services be available in the hospitals. Madam Speaker, even the contribution of SHA, it differs from one person to another, even the people who are really not able to pay. And I heard, Madam Speaker, when this SHA started, I think there was a group that the government said they will pay for those who are not able to pay. This is the time now, Madam Speaker, the government will bring that modality of helping other Kenyans. We have heard that nowadays people are paying the whole year. People who are not able to raise the money required. And I think, Madam Speaker, if there is that group, that category, that the government of Kenya intending to pay for those who are not able to raise, then this is the time now they have to come in and help. And I think what is very important is the services to be available. And this is a good motion, Madam Speaker. But I think let us not go that direction of making it mandatory for our civil servants to go and maybe to pay the insurances in those hospitals. Because unless the services are there, and I think the primary purpose of any insurance is for the person having that insurance, not the hospital. And we cannot force people to go and get services where there are no services. So, Madam Speaker, I just want to say that is very important, the personnel. And Madam Speaker, one issue here, there are private clinical hospitals and all that. But I don't know, Madam Speaker, I don't know whether this conflict of interest work when it comes to medics, because you find that somebody who is employed by the government is again working in another place and maybe owning those clinical hospitals and all that. So I think, Madam Speaker, that is another problem, and I want just to say I support, and that's my contribution, so that I can save time for other members. Thank you, Madam Speaker.
Thank you very much. The Honorable Robert Basil, member for Yatta.
Thank you, Madam Speaker, for giving me the chance to contribute to this motion.
Partially, I support the motion, and I have reasons why I support it partially. If you look at Sustainable Development Goals, number 3, we talk of good health and well-being, and Article 43 of the Constitution talks of rights to quality health care. However, if you look at our public hospitals, they don't provide such quality health care simply because they are in deplorable state, Madam Speaker. Therefore, Madam Speaker, we must improve rural hospitals and public hospitals for that matter, Madam Speaker, because the reason we have increased mortality rate, Madam Speaker, is because our public hospitals are completely unable to provide quality health care, Madam Speaker. Madam Speaker, if you ask members of parliament, most of us go to private hospitals. Why do we go to private hospitals? It's because private hospitals have all essential ingredients, the infrastructure required to support quality health care, which is lacking in public hospitals, Madam Speaker. Therefore, in a nutshell, we must allocate adequate resources.
I have a point of order. Order, Honorable Basil, I'll come back to you. What is out of order, Honorable Sabina Chege?
Madam Speaker, I just wanted to ask whether it's in order for the Honorable Member to mislead the House that the private facilities have everything that we need. I'll urge the Honorable Member, after this session, take a drive, go to Kenyatta University Teaching and Referral Facility.
Are you informing him?
I am informing him.
So I would like to ask him whether you'd like to be informed. Do you like to be informed?
Yes, she can inform me. I'm listening.
You can make it quick, Honorable
Very
Sabina.
quick, because that is the notion that is out there, that our public facilities don't have what it takes. I would urge you, and even any other member, even when you're doing your medical checkup annually, visit the Kenyatta University Teaching and Referral. We do not have such a facility in Kenya or East Africa. So we have the best, and we can even make the others the best. We can't say we will not go to public hospitals because they are in deplorable positions. We have the chance now to improve our public facilities. I thank you for agreeing to be informed.
Madam Speaker, I appreciate the information coming from Honorable Sabina Chege, but I want to tell her that Kenyatta National Referral Hospital, in theory, is a public hospital, but in practice, is very expensive, Madam Speaker. I've had bodies in that hospital who have been detained for more than 3 months because the bereaved family are unable to raise the exorbitant fees that are charged there. We have had a chance, or I've had patients from my constituency who have been unable to be cleared from that hospital because of huge medical bills. So the fees charged by Kenyatta National Referral Hospitals are equivalent to what is being charged in private hospitals. That's why I'm saying the public hospital you're talking about, these are the rural dispensaries, these are the hospitals like Kenyatta National Hospitals, where a majority of the poor are going to and which are affordable. But unfortunately, they lack the basic infrastructure to support quality health care, Madam Speaker. Therefore, what I was saying, one, it was a mistake to devolve health, Madam Speaker. We should consider taking health back to national hospitals. Madam Speaker, it's also important to understand that the remuneration given to staff in public hospitals is waning. And that is why the staff who are supposed to serve our people in public hospitals are demoralized, Madam Speaker. We have seen them demonstrating, coming to Parliament, seeking for better pay, Madam Speaker. So it's important to underscore that. Otherwise, the motion becomes more of a theory or more of an hypothesis as opposed to being a practical motion that can apply in our country, Madam Speaker. So allow me to submit so that I can now allow other members to contribute.
Thank you very much, Member for Yatta. The Honorable Kasim Tandaza, Member for Matuga.
Asante sana Mheshimiwa Spika kwa kupata fursa hii. Kwanza nianze kukubali kwamba hii ndio itakuwa dawa ya kusuluhisha matatizo ya hospitali ya umma. Kwa sababu kuna msemo ambao unasema kiatu usichokivaa huwezi kujua kinakufinya wapi. Kitanda usichokilalia huwezi kujua kama kina kunguni ama hakina. Sisi tulioko hapa kama wabunge tunazungumzia kwamba tungetaka wananchi wale wa kawaida wapate huduma bora katika mahospitali. Lakini kama sisi wenyewe hatuendi kule, tukaona vile hali ilivyo, basi moja kwa moja hata yale tunayoyazungumza kwamba tungetaka tuwe na fedha tuzipeleke haitakuwa. Ikiwa magavana wetu ikifika wakati wa kuumwa wanaenda Ulaya, na wao ndio ambao wana fedha za mahospitali, wao ndio ambao wanatakikana waweze kuweka vifaa katika hospitali, basi moja kwa moja fursa hii ya kuwa hospitali zetu zitakuwa bora ndio sisi tuende haitawezekana. Ni sisi tuende ndio tuweze kuziboresha, na nafikiri hiyo ndio maana ya huu mswada, kwamba ili hospitali za umma ziweze kuboreshwa, basi wafanyaji kazi wote wa serikali pamoja na wabunge pamoja na maofisa wengine, hata rais aweze kuhudumiwa katika hospitali hizi, na ndio hapo zitaweza kuboreshwa. Ningetaka kumalizia na swala la ugatuzi kwa upande wa afya. Hili ni jambo ambalo litokee na limesaidia kiasi kikubwa. Nitakuwa mfupi nikisema kwamba katika kaunti ya Kwale ile ninayotoka mimi, kwa miaka 60 ya uhuru wa nchi hii hatukuwa na mahali hata pa upasuaji, lakini kwa sababu ya ugatuzi sasa tuna hospitali takriban 4 ambazo zinatoa huduma ya ugatuzi. Hatukuwa na mahali kwa chumba kile ambacho kinaitwa ICU cha wagonjwa mahututi. Kwa hivi sasa tuko navyo. Kwa hivyo yule anayezungumza kwamba inahitajikana iregeshwe katika serikali kuu, nafikiri yeye labda anaishi kwa ulimwengu mwingine ama hajatembea katika zile counties ambazo zilikuwa zimeachwa pale mbeleni. Lakini mfumo huu unasaidia, na sitakuwa nimefanyia uhaki ikiwa sitaweza kuchukua fursa hii kupeana kongole kwa rais wetu kwa kuleta huu mfumo upya wa SHA ambao unaweza kutoa pesa nyingi, isipokuwa matumizi yake ndio yanakuwa ni mtihani, na suluhisho yake ni sisi kuweza kuenda katika hivi vituo na kuangalia na kukabiliana na yale mapungufu yaliyoko pale. Asante Mheshimiwa Spika, naunga mkono hoja hii.
Thank you. The Honorable Cynthia Muge, member for Nandi County.
Thank you, Honorable Speaker, for the opportunity to contribute to this motion that has been brought to the floor of this House by the Honorable Sabina Chege. Honorable Speaker, I appreciate her thoughtfulness in this, because, Honorable Speaker, healthcare is a matter that is dear to each and every one of us. And, Honorable Speaker, I must say that I appreciate the boldness in Honorable Sabina, because she has been able to aptly point the fingers at the right place. She has been able to state and mention the public servants, whom I'm included, Honorable Speaker. And, Honorable Speaker, if you look at the responsibilities that we take as public servants in whatever capacity that we serve in, Honorable Speaker, this is the team that is entrusted with the allocation and management of funds that go into the public sector. And, Honorable Speaker, I think it is just unfair that we have these people who have the responsibility of allocating and managing the funds to be able to feel the impact of their decisions, Honorable Speaker. And I don't think there is any other better way, Honorable Speaker, of having the public servants, the decision makers, be able to feel the results or oversee the results of the decisions that they have made. Honorable Speaker, I also see this as a proper incentive of improvement. We have spoken as members of this House, Honorable Speaker, to the matters and the issues that are affecting healthcare, including our displeasure about devolution of healthcare. Honorable Speaker, they normally say whatever has gone should be allowed to be water under the bridge, because probably we could reverse the decision, but as it is, we cannot reverse the decision, Honorable Speaker. So what we should do as a leadership is to find proper solutions to make sure that healthcare, while at the counties, or that while it is being managed at the counties, Honorable Speaker, not only works, but is, becomes affordable and to the people, Honorable Speaker. Lastly, Honorable Speaker, the reason why we have issues with public facilities is because of something called public confidence. The public, Honorable Speaker, has lost confidence in public facilities. One of the contributing factors of the public losing confidence in those public facilities, Honorable Speaker, is because most of the time, us, the decision makers, do not partake of those public facilities or do not use them, Honorable Speaker. And I want to support this motion. Of course, Honorable Speaker, there is a lot that needs to be done so that we can be able to get proper and quality healthcare services in the public facilities. And Honorable Speaker, I join in the members, in the comments of the members that have been made, Honorable Speaker, that this country has to make sure that the health facilities that are public work. That way, Honorable Speaker, we can then be able to make healthcare affordable. And I want to appreciate the coming in of SHA, so that in this SHA, Honorable Speaker, we can finally have the facility improvement fund working, and we can finally have the facilities down there that are called rural, Honorable Speaker, be able to have their money, be able to manage their issues, and be able to serve the people better. So, Honorable Speaker, I support this particular motion, and it must be noted, Honorable Speaker, that this is not, does not have an objective of exposing anyone to suffering, but it is a proper wake-up call to the leadership and to the servants in this country, Honorable Speaker, that healthcare must be accessible and must be affordable and must be up to proper standard so that the people of Kenya can be healthy. And a healthy nation, Honorable Speaker, will be a healthy nation going to the future. I support, Honorable Speaker. Thank you for the opportunity.
Thank you. The Honorable Janet CTNA, member for Turbo.
Thank you, Honorable Speaker, for giving me this opportunity to add my voice to this motion brought by Honorable Sabina Chege, and I would want to thank her for bringing this very important motion. Honorable Speaker, a healthy nation is a strong and stable nation, and therefore every person having a right to the highest attainable standard of health is a very important aspect. And therefore, I want to support this motion and request that we increase the funding for health, for our health care in this country so that we can be able to get quality health care services to our people and ensure availability of drugs in the hospitals, all hospitals from level 1 across board, ensure that their drugs are available. And Honorable Speaker, I would also want to support that we build the confidence in our institutions by ensuring that the public servants actually go to these facilities, which by doing so, we will be oversighting these institutions. Once we are there, we will even stop the doctors hopping from one private facility to the other to provide services, whereas they should be providing the services in the hospital
Order,
that they have
Honorable Janet. I know that there are members who would have really wanted to participate in this motion. The Honorable Charles Ngusi Anguna, the Honorable Kwenya, the Honorable Wilberforce Oundo, the Honorable Ibrahim Sanei, the Honorable Catherine Omanyo, among a few others. But it's unfortunate that now time is up. Honorable members, you have a balance of 8 minutes, Honorable CTNA, so you are free to come and participate another time. Honorable members, and the time now being 2 minutes past 1 p.m., this House stands adjourned until today, Wednesday, 23rd July 2025 at 2:30 p.m.